Brian Mudd Show is on News Radio 610 WIOD.
So as the vaccines roll out around the globe, some of the headlines are not only troublesome, but scaring people. Like this one, FDA, Moderna COVID-19 vaccine may cause side effects for those with cosmetic facial fillers. Here's another one. New York City healthcare worker suffers significant allergic reaction to COVID vaccine. Another, severe allergic reactions are a rare but possible side effect of COVID-19 vaccines. Dr. Fahmi Farah is a cardiologist, Bentley Heart Medical Center, Fort Worth, Texas. She joins me now. Doctor, is the media unnecessarily scaring people, or is there a reason to be concerned here?
Allergic reaction could happen to any medication or any vaccine. For instance, we receive the flu vaccine every year, and people do get allergic reaction to flu vaccine as well. So we got to look at the statistics and the percentage. To give you a perspective, out of the Pfizer vaccine, more than 272,000 vaccines have been administered, and out of those, only 6 allergic reactions were reported, and out of those 6, only 2 were severe allergic reactions. It was anaphylactic reaction. So that's less than, way less than even 0.5%. So in the big scheme of things, it's actually very, very rare, the allergic reaction. So I do believe that it's not much.
Doctor, when you take a look at the COVID-19 vaccines in the clinical trials, there were no reports of severe allergic reactions, but they excluded people with known allergies to components of the vaccines. Why did they do that? Why wouldn't they test this on everybody?
Right. With any medication or vaccination, it is advised that people who have allergic reactions to any part or component of the vaccine should avoid the vaccine. It was the same for flu vaccine. For example, for a while we were asking people who have allergic reaction to eggs to avoid the flu vaccine. And this vaccine is no different. The FDA did say if there are any people who have known allergic reaction to the ingredients of the vaccine, they should avoid the vaccine. And that's why those people who have known allergic reaction to certain components of the vaccine they were excluded from the study because we didn't want them to have the adverse reactions. And it's the same way now. People who have known allergic reaction to certain components, they should avoid the vaccine.
Talking right now to Dr. Fahmi Farah, cardiologist based in Texas, Bentley Heart Medical Center in Fort Worth. Doctor, you kind of hit on it a little bit. Who should and should not get the COVID-19 vaccine? Let's start with who should.
So this vaccine was studied I'm talking about, the phase 3 trial. More than 44,000 people were part of that trial. And the people who are not studied in the, in this phase 3 trial were pregnant women and children younger than 16 years of age. Mm-hmm. So everybody who's older than 16 years of age should receive the vaccine. And as for pregnant women, we just have to use caution. We can't say much because they were not studied during the trial period. But really, majority of the people should receive the vaccine.
Doctor, what do you say to somebody who is of the thinking, okay, I've been healthy my entire life. I don't feel the need to take this. I'm just going to rely on my immune system. I'm good to go. What would you say to somebody who has that mentality?
I would say it's not a good idea. This is a novel virus, a virus that has claimed lives, more than 300,000 people's lives, which is more than, what we lost in World War II. And it continues to take more lives. It's a very infectious virus. It's causing young people and old people to lose lives. It's somewhat unpredictable. So I would say to them that, it's highly advisable that when the vaccine becomes available, that everybody who can take the vaccine should take the vaccine to avoid further loss of lives.
One of the headlines making the news, making the rounds right now, doctor, is that there's a new strain in the UK, and it may even be in California. Should people fear that strain, or will that strain be taken care of by this vaccine? I heard that these vaccines, it takes a while for a strain, months, maybe years, to, I guess, become immune to a vaccine. So I guess what I'm asking you is, if you take the vaccine, will it protect you from this new strain, if there is indeed a new strain?
There is a new strain. That is correct.
Okay.
It is quite prevalent now in the UK. And as you mentioned, it is thought to be here in the U.S. as well at this time. As far as the vaccine goes, both Pfizer and Moderna are testing to see if the vaccine provides immunity to the new strain. They're saying that most likely it does, but it is still being tested at the moment. So yes, people should take the vaccine. There are 2 doses to the vaccine, both Moderna and Pfizer, and both the doses should be taken because it really takes the 2 doses to receive the full immunity, and they are saying it is 95% effective.
All right, one last question for you, doctor. I heard somebody, a friend of mine, said that their significant other got the vaccine, and the whole, I think it was the left side of his body, kind of like a Bell's palsy type of symptom. And I've heard that there's some Bell's palsy type of symptoms from taking this vaccine. Have you been seeing or hearing the same thing? And is that just sort of a minor side effect that's going to go away over time?
It was a minor side effect. So I have not seen it personally, but yes, there were, during the trial phase, there were 44,000 people receiving the vaccine, and out of that, only 4 people had Bell's palsy, which is a temporary weakness or paralysis of the facial muscle. And in all 4 cases resolved. They did have some reported cases in the UK as well with the Pfizer vaccine, and they all resolved shortly after.
All right, doctor, thank you so much for your time. Appreciate it.
No problem. Thank you so much for having me.